Hey guys, my name is Jessica Toulousin, and today I will be talking about basic health screening during an annual physical exam. A physical exam is considered a preventative step and a way to catch a more serious condition before it begins to cause problems. Some of the things your physicians may ask you about is your health history, take your vital signs, look at your general appearance, and conduct a heart and lung exam. He or she may also ask you to do a complete metabolic profile, complete blood count, and a urine analysis. Complete metabolic profile is a laboratory test done on your blood, and it's usually done fasting, which means you can't eat past a certain time the day before your blood test. What it measures is your glucose level, also known as your A1C. This can help diagnose if you have diabetes. The normal A1C range is from 3.9 to 5.5, or anything above a 7 is considered diabetic. BUN, blood urea nitrogen, is a waste product produced in the kidney and liver. A high BUN level can indicate heart failure, dehydration, or a diet high in protein. Low BUN levels indicate liver damage or disease and can occur in women in their second or third trimester of pregnancy. Creatine is a waste product produced when muscle tissue breaks down. Uric acid is a compound that arises when food is consumed. Too much uric acid can cause gout and is monitored in those receiving radiation treatments and chemotherapy. Electrolyte levels. If your blood test results indicate an altered potassium, magnesium, sodium, or calcium level, you may experience muscle spasm, weakness, twitching, or convulsions. Proteins are measured, like globulin, which is important because it actually fights off disease. ALT is an effective way to see if your liver is functioning correctly and is seen as a measurement of overall health. Enzyme tests are done. Liver disease, bone disease, and muscle damage can all be found in enzyme tests when they may not be found in other panels that are run. Complete blood count. What this measures is your red blood cell count. Red blood cells carry oxygen from lungs to the rest of the body. They also carry CO2 back to the lungs to be exhaled. A low RBC count, also known as anemia, can indicate that your body may not be getting enough oxygen as it needs. A high RBC count, also known as polycythemia, means that your blood can clump together and block tiny blood cells. White blood cell count. White blood cells help fight infection, and there are 4 different types. Too many or too few of a certain one can help identify what type of illness the body is fighting, such as infection, allergic reaction, or leukemia. Platelets, also known as thrombocytes, help with blood clotting. These help to stop bleeding by clumping and clotting blood cells, or blood vessels. Hemoglobin is the oxygen-carrying protein in red blood cells. Hematocrit measures the amount of volume red blood cells take up in the blood. Urinalysis. Urinalysis is a test done in your urine which helps detect and manage disorders such as UTIs, kidney disease, and diabetes. So they do 2 different tests on it, the dipstick test and the microscopic exam. And the dipstick test, they look at the acidity, the concentration, protein, sugar, ketones, bilirubin, nitrites or leukocytes esterases, and blood. The acidity, which is the pH, helps indicate the amount of acid in the urine. Abnormal pH levels may indicate a kidney or urinary tract disorder, and it's usually around 4.5 to 8. In the microscopic exam, they try to see if you have any white blood cells or red blood cells, bacteria or yeast, casts, and crystals. These are usually not found in your urine, so when they do see them, it means there's like a sign of infection, disease, a disorder, or even stones. These are the references I used for this presentation, and I hope it's been very informative.